Are you a beginner and don't know where to start your yoga journey?
Sitting asanas increases the flexibility of the spine, stretches the ribs, and increases the blood flow to the brain. Practice these 3 asanas every day to reduce backaches and promote spinal alignment. Malasana. Stand in Tadasana, legs shoulder width apart. Inhale and place your palms in Namaskara. Exhale and slowly squat down. Your torso should fit in between your thighs. Using the elbows, push the knees out. Hold the posture as you breathe in and out slowly and deeply. After a few breaths, relax and sit in Dandasana. Benefits of this asana: stretches the ankles, thighs and groin, also tones the belly by pressing the abdomen closer to the thighs, improves the function of the colon to help with elimination. This pose also increases circulation and blood flow in the pelvis. Contraindication of this asana: severe knee pain patient should avoid this practice. Yoga Mudrasana. Sit in Dandasana. Right foot on the left thigh, left foot on the right thigh. With your right palm, make a fist, thumb in, not too loose or too tight. Then hold your right wrist with your left palm. Inhale deeply, expand your chest, and slightly lean back. Exhaling, bend forward from the bottom of the spine. Bring your forehead or chin towards the floor or close to the mat. Keep breathing while being in the posture. While inhaling, straighten the spine and release your hands. Benefits of this asana: it helps in relieving constipation, stretches the spine and neck. Regular practice of this asana improves the lung capacity. It relaxes the mind by giving good blood circulation to the brain. Contraindications of this asana: don't force the forehead to touch the mat. It may injure your neck. If you have knee pain, then avoid doing this practice. People with heart conditions and high BP should skip this practice. Parvatasana. Sit in Padmasana. Stretch the hands up from the sides and join the palms. Keep on stretching up with each new breath. While exhaling, drop the hands down. Come back to Padmasana. Benefits of this asana: it improves the alignment of the spine. It can help reduce shoulder and back pain, strengthens the muscles of the back and corrects minor posture defects of the spine, stretches the abdominal muscles. Contraindications of this asana: frozen shoulders and arthritis patients must avoid practicing. People suffering from severe back pain, knee injury, ankle injury must avoid this.
Listen to your body and be mindful while practicing these asanas. Consult a medical professional if you feel uneasy anytime.